So I just wanted to show another example of the way you might see a cord. The one that we had prior was obviously much more full of blood and tense. This one's a lot flatter, so it might be harder to identify the vessels. You can see there's still a big vein right there, and here's some little arterioles. So we'll see how this one draws when we get to that point. Also, I wanted to show out the labels. I've already gotten the labels, two labels. These are the labels that come with the Pulsator or blood sampling kits. 1A, 1V. So for arterial and venous, that way we don't get our samples all mixed up. And then, of course, when the baby stickers come back, we'd want to label it with the baby's actual sticker. But for our purposes today, we just did the initials of their last name. But you can actually write their name in there and then just have the two labels all ready to go. So here's our little pre-heparinized syringes again. And first, let's do the little arterial ones. And we're going to start from the top end, the closest one we can find, and then we have to do it a couple times again. That's not one to dry at all. So we'll just keep moving down. And just get as much as we possibly can. Okay, so we have that area all dry. Let's see. Looks like this is more artery right here. Just pulls it out so fast. And with this, when it has those big spots like that, those are going to be venous. So I'm going to avoid those. Down here. Okay. So it looks like that's probably all we're going to get from this one. It's pretty much all drawn out. So let's see how much we have here. We're going to go ahead and get the air out. Okay. So we don't have a lot. So we'll send that and see. We got to get our little cap again. And that's our arterial. So we'll go ahead and get the label on it. Okay, so now let's draw the other one. There's not a stick in there. Again, we just want to make sure that we're doing a vein for comparison. And that's probably going to be plenty for that one. Okay. So now we're going to get these on ice real quick, label them as soon as the baby stickers come back, and get them to the lab. So much better to get a cord that's as full of blood as you possibly can, just so it's easier and you get more of a sample for the lab. I'm not sure if that would be enough for the lab, but we'd still send it and hope that they could run something off that. Again, you can kind of tell the difference in the color, so that's another way to kind of say that, yep, we probably do have arterial and venous. These also, this had been sitting here for about an hour, so if you do it sooner after delivery as possible, I think it makes it easier to draw them. Okay, so thank you.